Hi, and welcome to Verve Plastic Surgery. I'm Dr. Gupta. I know you are here to see me, and I'll be with you shortly. In the meantime, I wanted to show you this video so that you can go over the main concepts that we will be discussing. After this video, I will be with you, and we will discuss any personalized situations and personalized questions that you may have. So today I'm going to talk about some of the, I would say, late complications of breast implants, whether that is capsule contracture, which is firmness of the scar tissue around the implant, or an actual breast implant rupture. These can be correlated since one can give rise to the other problem. But whether you have one or both of these problems, the following information will still be useful for you, since the solution, the explanation, the surgery itself remains pretty much the same in either of those cases. So to understand this whole consultation, we'll start with trying to understand what is exactly happening inside. There is a silicone implant, and any implant in the body creates a layer of scar tissue around it. That scar tissue layer is called capsule. Now, in some cases, the capsule can start contracting, shrinking, and squeezing the implant in doing so. And that's called capsule contracture. Now, capsule contracture can cause the implant to rupture, or in other cases, the implant may rupture, and that may cause the capsule to contract. So you may have, as I said, one or both of these problems, but regardless, what we need to do is remove that capsule, so remove that layer of scar tissue, and remove the old implant. That is something that needs to be done to alleviate the problem. Now, the other concerns patients have is this silicone dangerous for their body? So silicone by itself is pretty inert. It causes local inflammation, but it does not go in rest of the body systems to cause any general harm to the body. So you're overall safe, but it needs to be cleaned up, because otherwise it will keep causing inflammation in the area and you will have more and more pain. So it needs to be cleaned up, but your body or your health is not in any immediate danger. In case there is a silicone rupture, then we will also need to clean up all the silicone that has already come out of the implant. Now, in most cases, when the silicone comes out of the implant, it still stays within that bag of scar tissue, the capsule, what we call intracapsular rupture. So in those cases, it's very easy to clean the whole thing by removing the whole bag. But then you will have multiple options as to what do you want to do next. If you do decide to not have any other procedure, your breast will be very empty at the bottom, and you will sort of have hanging skin, which does not look aesthetically pleasing. So overall is not recommended. The second best option in that case will be at least do mastopexy, which is breast lift procedure. By doing so, at least we can remove the extra skin, we can lift the breast up. You will still have very empty looking breast and smaller breast, but at least it will not have too much sagging, and it will have a proper shape of the breast at least. Next option will be to actually put an implant back in, maybe with or without the lift. That will once again give you the top fullness. And most patients will want to have their aesthetic look back. So at least this option provides that. And it can be done at the same time, where we remove the old implant, remove the capsule, put a new implant in. Now, the final option is, in addition to putting an implant, we also put a small graft to prevent this problem from happening again. What happens is, whether you have a rupture or a capsule contracture, there is so much inflammation in there that even when we put the new implant, there's a very high percentage, roughly about 40%, 30 to 40%, where you will have a repeat capsule contracture within first year of the revision. So to prevent that, We put a small graft which is made of donated human cadaver skin, but it's completely inert. Your body does not reject it, and within 3 months actually your body grows into it and the whole graft becomes part of your body. So we put that graft in, and the chances of you developing the repeat contracture drop down from 30 to 40% to about 2 to 5%. So it's very effective. One very common concerns that patients have is whether it's going to be covered by insurance or not. So now if you are a breast reconstruction patient, which means you had breast cancer and the implants were placed for breast reconstruction, the whole process, the replacement, the removal, everything is covered by insurance. If these implants were placed for cosmetic reasons, in that case, the removal of the implant and the capsule will also be covered in most cases. But replacement of the implant or any other procedure will not be covered. So once again, to recap, for cosmetic patients, you will have the options. And the options were, number one, just remove the implant, do nothing, not very aesthetically pleasing. Number two, at least do a breast lift. Your breast will be very empty at the top, smaller, but at least will not have too much sagging and extra skin. Number three, replace the implant with or without the lift. That will provide you additional fullness as well and will be aesthetically pleasing, but will have quite high incidence, about 1 in 3 chance of having the same problem, capsule contracture problem, again within the first year. And finally, the best option will be to replace the implant, maybe do a lift, and use the graft to prevent this from happening in the future as well. Thank you for listening to this video. I will be with you shortly. Please think of any questions that you might have. Please go over the folder that was given to you, and then we will go over your specific situation and your questions.